Today we're going to talk about constipation. Constipation is a fairly common issue. Up to 20% of children, up to 50% of adults, and up to 75% of older people can suffer from it. To understand what constipation is, it's delayed, difficult bowel movements, or a disruption in the process of defecation. How can you tell if it's delayed? You need to understand what the normal, usual frequency of going to the bathroom is. For an average person, it can range from 3 times a day to 3 times a week. So, for a particular person, constipation is determined by comparing it to their own usual, normal, traditional rate of bowel movements. There's a very simple test you can use at home to determine this. That is, the speed of stool passage. You can use boiled beets. Grate them and eat about 150 grams. Then wait to see when your stool changes color. That will be your usual, traditional speed. There can be several main causes of constipation. The first is dietary issues, for example, consuming too little dietary fiber or eating infrequently, just once or twice a day, which can lead to constipation. Not drinking enough water, that is, having a low daily water intake, also causes constipation. Low physical activity, that is, if you don't move much, or if, for example, you're on bed rest or have a long-term sedentary job, this also leads to a tendency for constipation. Another main cause can also be holding in your stool. For example, think about when you go to visit someone or to a public place and you don't have the opportunity to use the restroom at that moment. You end up holding back the urge to have a bowel movement. This contributes to a disruption of the visceral, that is, the nervous system of the intestines. Another cause can be a pleasant and wonderful condition for women, pregnancy. This is a physiological condition, but it leads to constipation. Another cause is a disruption, for example, a blockage in the intestines. This can be caused by inflammatory bowel diseases. It can also be caused by growths in the intestine, such as polyps or diverticula, or by growths of an oncological nature, for example. Diseases of the anorectal area or rectum, such as fissures or hemorrhoids, can also cause constipation. This can also lead to constipation. Another cause of constipation can also be mental disorders. For example, if a person is anxious, nervous, or traveling, they may develop irritable bowel syndrome with constipation during this time. This is also one of the causes. Constipation can also be caused by taking antibiotics and certain medications, for example, those used for diabetes or hypertension. There are also cases of constipation due to congenital anomalies, such as an elongated colon, which is called dolichosigma. So this is also one of the possible scenarios. And of course, spinal injuries, these disrupt nerve supply. In such cases, there is also a tendency toward constipation and impaired intestinal motility. The main symptoms of constipation are passing a small amount of stool, hardness and dryness of the feces, a feeling of incomplete bowel emptying, as well as lumpy stool that looks like nuts or goat droppings. But it's not necessary to have all of these symptoms at once. Just one is enough. There is such a thing as acute and chronic constipation. Acute constipation is a situation that occurs for the first time and lasts up to 3 days. If, for example, you have a bowel movement only twice a week, that's already a cause for concern. And then there's the concept of chronic constipation. Chronic constipation is a condition that lasts for at least 6 months, and in the last 3 months, the frequency of complaints occurs in up to 25% of cases. For example, every 4th trip to the bathroom is accompanied by straining, passing hard stools, a feeling of pain in the anorectal area, or the need to use your fingers to help evacuate the stool. The combination of two such criteria is already enough to make the diagnosis of chronic constipation. But I want to make it very clear to all of you that constipation is not only a standalone disease, it is also a symptom of many, many other conditions. Constipation requires a very serious approach and thorough diagnosis. For example, tests such as stool analysis for digestion, stool test for occult blood, stool culture for dysbiosis, and instrumental examinations like irrigoscopy are very relevant and important. There is an excellent method, fibrocolonoscopy, which allows you to examine the entire space of the large intestine. And there is another method called multi-slice computed tomography for virtual colonography. This particular examination allows you to see what is behind the intestines, the entire lumen of the bowel, and the intestinal walls. I actually prefer this method in certain cases for diagnosis, especially if constipation is accompanied by alarming symptoms like weight loss or severe pain. This requires seeing a doctor.